lambda. Okay. This lambda, like here we have anterior fontanelle. Here before lambda we have posterior fontanelle. Till the age accepted till 6 months. 6 months earlier than this. It closed before this. Okay. Till the age of 6 months. Okay. Importance of this fontanelle, like the importance of anterior fontanelle, to give space for the growth of the brain. Okay. So here, posterior fontanelle in the baby till 6 months. After this, it will be ossified, forming lambda. Okay. So again, in the normal verticals, when I look to the skull from superior, I will find frontal bone anteriorly, 2 parietal bones on both sides in the middle, and posteriorly I have occipital bone. I have 2 important sutures, one present anteriorly transversely in the coronal blade, coronal suture, and in the midline I have sagittal suture, and posteriorly I have lambdoid suture. I have 2 important points here. This point is bretma, this one is lambda. Okay. In the skull, you will find many small foramina like this. Small foramina like this. This for passage of small veins, termed emissory veins. You will take inshallah. Emissory veins. Connecting the superficial veins in the scalp with veins in the skull cap here. Okay. Superficial veins. Okay, and this also connecting these superficial veins with the deep veins of the CNS of the cerebrum, okay, the brain, okay, dural venous sinuses, the venous drainage of the brain, okay. So this is important clinically, but in the practice you will not be asked about this imaginary foramina, this is small foramina, but to know this is one of the important sites for this imaginary foramina. This one present besides sagittal suture, termed parietal imaginary foramina. We have one here and sometimes yes, other one here on both sides of sagittal suture. Okay. This is as regard the normal vertical. As regard occipitalis, you will find, as I told you, here occipital bone, lambdoid suture, lambda. If you look here downwards, okay, you will find that here in this part of normal occipitalis, you will find here elevation or protuberance. Protuberance means elevation. This midline protuberance or elevation is termed external occipital crest. External occipital protuberance. Yes, external because on the interior you have also internal occipital protuberance. Okay, internal. One. From this external occipital protuberance, you have this median crest, this median ridge, termed external occipital crest. External. We have external occipital protuberance and external occipital crest. Okay, crest. Linear ridge or elevation is termed external occipital crest. And this one is external occipital protuberance. And extended from the sides of this external occipital crest, this line is termed superior nuchal line. Nuchal, because this is present the back of neck, anything related to back of neck, nuchal, nuchi, neck, yes, nuchal. So this one is termed superior nuchal line. Superior, yes, superior. This apparent well line extended laterally from the external occipital protuberance is termed superior nuchal line. Superior nuchal line. And we have other one inferior to it, which is termed inferior nuchal line. Inferior nuchal line. Inferior nuchal line. Okay? When you take a scalp, you will find that also we have other one imaginary. Above the superior, we have the higher or highest nuchal line. Highest nuchal line, but not present. Okay? Just above the superior nuchal line. Okay? But here we have the prominent landmarks here. External occipital crest. External occipital crest. External occipital protuberance. External occipital crest. regard norma occidentalis, norma verticalis. What about the norma frontalis? Base, bones. You will find here also extended here is a frontal bone. Okay? You will find the prominent openings. Orbital opening, two orbital openings, nasal opening. Okay? Here you will find in this region, you will find here, these are the nasal bones. We have two nasal bones, two small nasal bones. Yes, these two nasal bones. And you will find a sort of transverse suture, this one. This small transverse suture, this one. Between the frontal bone transverse suture. Between frontal bone and the nasal bones. So it will be termed fronto-nasal suture. Fronto-nasal suture. This in practice not important. Again, I mean everything in medicine is important. Everything in anatomy in our human body important, very important. But I mean by important for you in the practice, thing is common in the practical exams. Okay? So when I tell you not important, this not means that not important. Because we are talking, inshallah you will be doctor. And when patient come to you, you will not tell him I'm not sick with this part. I have no idea about this. Okay? Everything important, but when I tell you important in practice, it's common question. Okay? So not important, not common in the practice. Okay? This suture is important clinically, but not important in the practice. This transverse suture present between frontal bone and nasal bone. So it will be termed
frontonasal suture.
Frontonasal suture. Frontonasal suture. In between the two nasal bones, you will find the vertical suture. Internasal suture. Internasal suture. And the point of meeting between the internasal suture and the frontonasal suture, this point is termed from north. Nasion, this point.
Nasion.
Nasion, this one, this point. Between internasal suture and frontonasal suture, nasion. About this nasion, you will find especially in male. In all of you, this point between the eyebrows is more elevated.
Yes.
This elevation is termed glabella. Glabella. And in physiology, when you take reflexes, they will tell you that in babies, we have reflex termed glabellar reflex. When you make tape on this glabella in baby, you will make twitches. Glabellar reflex. Okay? This is the glabella, prominent in males. This is the glabella. But this point of meeting of both sutures termed nasion. So point of meeting of internasal and frontonasal sutures, this point is termed nasion. But elevation above it is termed glabella. Clear? Okay. Here you will find the orbital openings. You will take inshallah later orbit. Later on you will take orbit. Or you take it before? No. You will take it late orbit, inshallah. And you will take orbit, soft orbit and bony orbit. Interior of this bony orbit. You will take about the details of this. But just today to know that we have this orbital opening has a superior margin, lateral, inferior, medial, inferior, and lateral. Okay? And this elevation, can you see this elevation? Okay, in the side of the eyebrows.